News this week that the VHI were dropping the prices of a third of their health insurance packages was a welcome surprise for consumers, all too used to annual rises in their premiums.
Now, could this be the first sign of a price war between health insurers? Well, here to explain and give advice on how to get the best value package for you and your family is consumer expert Siobhan Maguire. Good morning to you,
Morning,
Siobhan.
Siobhan. How are you?
Isn't it quite unusual what they've done in the first place to reduce any level of their packages?
Absolutely, Anna. I mean, if we look at health insurance in Ireland, say over the last decade, 2 decades, from 2001 until 2015, price insurance just kept going up and up and up, and we weren't getting any valid reasons why this was happening. It's kind of levelled off a wee bit with increases slight in the last 2 years. But even this year, you would have had, out of the 4 providers in Ireland, you would have had Leia Health and Irish Life Health, formerly Aviva, putting up prices. So when the VHI announced these price cuts last week, people kind of sit up and go, well, this is good news, isn't it? When you kind of crunch the numbers and look at it a wee bit more closely, they have chosen to drop prices on 26 of their 78 products. A lot of these are legacy products, so they would be plans that people simply don't switch. If they go onto it, they stay on it. So the cuts are quite small as well. If you look at the Health Plus lines that are being cut, the Access plan, which is comes in at around $2,000 a year for an adult health insurance, is getting a 1% cut. That's €21 per annum. Now, the Platinum, the premium plans that are the more expensive plans, come in at around €5,000. They're getting a 5% cut, so you're looking at a saving of around €265. Now, before we start patting VHI in the back, let's look at how they do in the current climate. They have over 1 million customers in Ireland. And last year, they had profits of €56.4 million. So saving Mr. Jones €21 isn't going to make a hell of a difference.
It's pretty meagre, isn't it?
It really
in terms
is,
of savings?
yeah.
So is it much ado about nothing, or should we be looking more at the bigger picture and what it might do in terms of Leia and Irish Life?
This is it, Simon. Yeah, it's all optics at the moment, I think. But that's not to take from the fact that the gesture is there.
Yeah, exactly.
And it is heading in the right direction. And Glow Health, I mean, they haven't adjusted their prices. They may well see VHI this year or last week doing this and go, well, you know what, we can do better. Or Leia Healthcare and Irish Life Health, as I said, put up their prices, but they might say, well, you know what, we can bring the prices down a wee bit now. So it has opened up a conversation and a debate on will it bring prices down?
And if we're not a holder of one of these policies, so the Health Plus Access policy or the plans B to E, which are the ones that have been reduced, whether we are or we're not, does it kickstart this whole shopping around process?
We should be shopping around anyway.
Because we're not necessarily, and we talk about this a lot, don't we, a nation of switchers.
We were talking this morning about the One Big Switch campaign, and one of the questions I asked David was, are we a nation of natural switchers in terms of, is our curiosity there and do we follow through on it? We should be, shouldn't we? Because there's value out there.
Absolutely, Simon. Yeah, the Health Insurance Authority, they're the regulatory body for health insurance providers in Ireland. They have an excellent website that do an awful lot of comparison plans between different providers. But they did a very interesting survey in 2015, which they published last year, which found that 24% of Irish people switch their health plans. Now, that is paltry. 70% have been in the same health plan for more than 2 years, and 80% said they have no plans to switch. So, and when you think of the nation, 2.51 of us have health plans. That's a very small amount of us who are switching or looking to get a better plan.
All right, so I'm looking to switch my health insurance at the moment. So how do I do it? Where do I go? Is it an easy process?
It is an easy process, slightly arduous, but necessary. Can I ask, where are you in your health plan? Are you coming up to a review period?
I think we are,
okay.
yeah, but I don't think I've got sufficient cover is why I'm
Right.
changing it.
Yeah.
I think we are due for renewal. I'm not too sure I have to look into it, but I need to increase the level of insurance.
But the reason the VHI are changing these prices is because it is close to renewal date, is that right?
Well, we're coming into kind of peak renewal
Yes,
period.
yeah.
Yes.
So, it is. They are seen to be very proactive in terms of the lead into this. So people might go, well, VHI have dropped their prices.
Where's
so
my
timing
first,
is no
Where's my
accident.
first port of call? Is it the regulator's website to do a comparison on that, or where do I go?
HIA.ie is an
HIA.ie,
excellent website to get your comparison of prices of what plans are out there and the differences and all that kind of thing. But what I would do is call up my existing provider, explain to them how I don't feel my cover is adequate at the moment. What can they do for me? And then I would go to the other three insurers and find out what they can do for me. I mean, the thing is, information is key in all of this, but transparency even more so. There are very strict rules in terms of health insurance provision in Ireland now. Every single health insurance provider has to take you on. None of them can turn you away. You can't be discriminated against. And you also are entitled to ask as many questions as you want. Conversations are recorded. You can also ask for those recordings to be
Copies
reviewed.
of them, yeah.
If you feel that, you had specifically said, well, look, this illness is in my family. I need coverage in the matter private, for example.
And it turns out you weren't covered. You can go back and check on that.
Because there is a sense sometimes you need to fall in with one of their plans rather than kind of cherry picking what you need.
Or
isn't
them
there?
you're tailor making a plan to suit your needs.
Exactly.
Exactly.
So HIA.ie is a good starting
HIA.ie
point.
is an excellent starting point.
And knowing your
yeah.
rights, as we saw in the graphic there as well, is so important. I always think in business we shop around for three prices before you settle on one.
Yeah.
And we should be treating our household exactly the same
Absolutely.
way,
Most
shouldn't we?
definitely, yeah. But there's little pointers you can keep on board. If you want your children on your health plan, they don't necessarily have to be on that health plan. There's no private children's hospital in Ireland. Therefore, there's no point in having them on a private insurance
health
package.
insurance,
Just the little things to check.
Okay, thank you, Siobhan.
Thank you.
Thank you very much, Siobhan.